We are a nation spending 16% of our gross national product on health care. That's $2.1 trillion. 3/4 of those expenditures are on chronic diseases often linked to smoking. You heard me say earlier, if you're at the school, cigarettes remain the one legally obtainable product in the United States, which when used as directed will kill you, and we continue to sell them and allow people to use them. It's a tragedy. As I looked at the prevention portfolio, it was obesity, childhood obesity, all of those things, smoking kept coming back. I published the 27th and 28th Surgeon General's reports on smoking. The last one was the one on secondhand smoke, which was really a shot heard around the world. It has created such a positive environment for healthy, clean air environments, eliminating smoking. It's one that we're very proud of. But my predecessor, Luther Terry, the Surgeon General in 1964, over 40 years ago published the first Surgeon General's report saying smoking causes cancer. And isn't it ironic that 28 reports later, over 40 years later, the 17th Surgeon General of the United States stands before you, tells you the same thing, and yet every year almost 500,000 people die of tobacco-related causes, and millions more suffer from what's called a comorbidity, cardiovascular disease, emphysema, because, you know, smoking doesn't kill you right away. It sucks your life out of you over time. So by the time you start smoking as a child, and 4,000 to 5,000 kids a day in this country start smoking, and half of them remain chronic smokers, and if they do, they'll shorten their lifespan by 14 years, but that's not the bad news. The last 10 or 20 years of their life will be short of breath, will be fighting cancer, maybe a heart attack, maybe an aneurysm. So when you look at the disease burden that's entirely preventable from tobacco, the economic burden that you as employers all pay for, because anybody here, whether you're the police chief, the fire chief, owners of a company, head of a university, your workforce that you provide insurance for that is subjected to primary or secondary smoke is costing you astronomically higher amounts than if smoking wasn't in the environment. So there is a reason that everybody in this room should be involved. Even if you don't smoke, even if your workplace is smoke-free, there's still smoke in your environment, and it's going to affect your citizens, and ultimately will cost you a lot of money in health care costs. Smokers cost you more money. Secondhand smoke costs you more money because good people have to breathe that stuff in, which has all of the carcinogens and all of the toxicity. When I published that Surgeon General's report a year and a half ago, my first words in the press conference, because I wanted to resonate, I said, the debate is over. Secondhand smoke kills. Make this a very high priority. We must eradicate tobacco usage in this country. We're not going to do it all at once. I understand that. When I got to Washington, I was looking for magnanimous legislation to wipe out disease and famine and pestilence. It doesn't happen. It's about incrementalism. But every day that we prevent another child from smoking and decreasing the demand for tobacco products is a day that we buy and invest into our future. That future that will be healthier, that healthcare costs will be less. That's what I'm asking you all to make the commitment to do. We cannot afford the legacy we are going to leave our children and grandchildren if we continue on this trajectory. The epidemiologic studies today show that with our childhood obesity epidemic, with smoking, with preventable disease, we could be raising the first generation of children in this nation's history that will live less than their parents because of all of the preventable disease that we are layering on them. And tobacco is at the top, guys. Don't wait for a legislative remedy. Don't wait for laws to be passed. You have the information. You are the people. You are empowered. The greatest changes I saw after my Surgeon General's report on secondhand smoke weren't legislative. They were communities calling me, hundreds across the country, saying, thank you, Surgeon General. I'm going to make my restaurant, I own 8 restaurants in El Paso, Texas, I'm going to make them all smoke-free today. I had businesses calling. I had buildings. I had city managers. Mayor Bloomberg from New York City saying, that's good. We're going to make New York City smoke-free. Sometimes it takes elected officials. You all have the power to make this state smoke-free. You have a path that you can go on to do that. And it includes legislation as a remedy. But you know what? I always, My sense is I don't want government making all my decisions for me. You've got a lot of smart, charismatic, passionate leaders here. Listen to what they're telling you. Let's take this ourselves. Let's challenge this ourselves. Follow Dr. Mercer. Follow the other leaders in the community. Make the changes. Invest in your future by eradicating tobacco use in Wheeling, in West Virginia. Be the model.